Hello, in this video I will be talking about joint pains that show up after chemotherapy. Before I go on, I'd love to invite you to subscribe to our channel. We are always putting out new and interesting content, much of which comes from you, our viewers, who make a suggestion to us in the comments. So have you completed chemotherapy and are you finding yourself achy for the first time ever? What's causing that? And what should you expect going forward? This is a phenomenon that's not written about in the medical literature. So it's something that an experienced clinician who's been practicing for many, many years might see. The first thing is chemotherapy may stop your ovaries from working. If you have ovaries that were working at the time you got chemotherapy and then they stop working, whether it's temporary or permanent, you are in something we call chemopause, and if it's permanent, menopause. The most common symptom when people go through menopause, you may hear this referred to as the change, is joint pains. We think a lot about things like memory problems, and we think about things like hot flashes and night sweats, but actually the most commonly endorsed symptoms is joint pain. All those hormonal fluctuations can make our joints feel achy. So if chemotherapy was responsible for causing your ovaries to stop working temporarily or permanently, it can be for that reason. The other thing, and I'm going to give a little background here, so stick with me. The other thing is that chemotherapy treats inflammation. So something you may not know, but people with autoimmune diseases, if they're not responding to other treatment, may actually be treated with the same chemotherapy we use for breast and other cancers. Cyclophosphamide, which is the C of AC, might be something we use, or methotrexate, which is the M of CMF, a very good chemotherapy as well. And that's because chemotherapy decreases inflammation. So you may say, I wasn't having any joint pains or inflammation before. How did chemotherapy treat it? Well, imagine this. Imagine you have some low-grade inflammation in your body that you haven't noticed or that's causing no symptoms at all. Then you get chemotherapy for breast or another cancer, and the treatment suppresses any inflammation that you had. Again, inflammation you may not have known about. Then the chemotherapy stops. What happens to the inflammation? It actually comes back and it can rebound. So it can actually now become what we call clinical or symptomatic. So you had subclinical inflammation before. We treat it. Again, you didn't know you had it. We stop the chemotherapy because you're done, and now the inflammation comes back. So it's a phenomenon that makes total sense, but a lot of people, in looking at the literature, it's not in there. It's really something we call phenomenology, which just means we hear it from our patients and it's important, but there are not a lot of studies that have shown this to be the case, because again, not everybody has subclinical inflammation. One thing that we hear a lot is, I never was having aches and pains, and now I do. Chemotherapy caused this inflammatory condition, when it's actually the opposite. Chemotherapy treated an inflammatory condition we didn't know about. Now it shows up, it will settle down. After the chemotherapy is over and that rebound happens, it'll go back down and it should go back to the way it was before. If you had an undiagnosed autoimmune condition that's a real condition that was just brewing, and I don't mean real like the others aren't, but something like rheumatoid arthritis, psoriatic arthritis, lupus, scleroderma, it's possible that coming off chemotherapy can unmask a condition your body was on track to get that had not yet been diagnosed. And now, of course, it will be diagnosed because you're having symptoms that suggest something like rheumatoid arthritis or lupus or psoriatic arthritis. There's a very long list of autoimmune conditions. So chemotherapy didn't cause that autoimmune condition, but it revealed it. I hope this is helpful. If you have questions or comments, or if this has happened to you, let us know. And it's not just us you're letting know, it's all the people reading the comments in our Yerbba channel. Thank you for watching.